Hello, my name is Erin and I am an occupational therapist.
And I'm Lisa, a physical therapist.
And today we are here to discuss upper extremity and lower extremity range of motion. So first, before we begin, we just want to let you know that it is important that you consult with your student's current therapist and or doctor to discuss range of motion. It is best that you do in-person demos. However, if that's not possible, we're hoping that this video can also be helpful. But again, always important to be able to consult the student's current therapist. Okay. All right. So when we were working on active shoulder flexion, which is when your arm goes straight up, excellent. It's important that we work and using both hands, one to stabilize, okay, and then one to move. Now with some of our students, they might not have full range, as in they might not be able to go all the way up. So what you're going to do is you're going to slowly bring them up until as far as you can feel some resistance, as in you feel like you're really pushing on their arm and you can't go up anymore. All right?
And make sure you're watching their face. I know now I have a mask on so you can't see, but if the student is grimacing and you can tell that they're in pain, you can tell a lot by facial expressions. Then you should stop and not go that far.
Right. And so you're going to always want to hold it to where they're at. Slowly bring it back down. And then you can do the same thing again. So that is for range of motion for the shoulder. Next, we're going to work on positioning here for the forearm, and we're going to work at the elbow. So we have elbow flexion. So right here, the elbow's going to be bent and out. So if we're working on elbow flexion, they're going to come in. You're going to stabilize at the elbow. And again, you're just going to move it slowly until either they can maintain the full position, or again, where we feel some of that resistance, or if our student is feeling any pain or any resistance themselves, please take a look at their face.
And if you watch Erin's hand position, she has one hand at the wrist, the other one like at the elbow, or sometimes people hold it like slightly above. But make sure you're supporting the forearm and the upper arm.
And then we go out. Miss Lisa has some good range of motion. She can get to full position. And that is our forearm and elbow range of motion. Okay. Next, we have the wrist. So again, sometimes our students are positioned in what we call a supinated position. Sometimes we can turn it so then this would be a neutral position. Sometimes our students are in a pronated position where their hands are flat. So what I'm going to do is I'm going to work in supination, so their hands up, like they're holding a cup of soup. And I am going to work on wrist extension here. We're going to again stabilize here at the top of the wrist. And then I'm going to hold down here. So on the side, in their palm, I guess, on the side of their pinky and the side of their index finger. And I'm going to slowly again bring their hand out.
You want to get at least to neutral, and then you can go further if it's possible. But once again, watch for grimacing. Make sure it's not painful.
And I can feel that that's probably about as far as Miss Lisa can go. So, some slight. Take a look there. Okay.
Okay. Did you want to do like grip, like finger flexion and extension?
Oh, yes. Okay. So some of our students are in positions where their fingers are closed, they're tight, making a fist. And then some of our students do have that open hand position as well. So for our students that are in more of that fisted position, what we want to do is we want to hold again at the top of the wrist. So just like right here, okay, their fingers there. And so what I like to do is I like to slide my thumb in, try to get under their fingers, okay? I keep my hand on top, and I slowly use my thumb on the top of my hand to open. Again, looking for either that resistance if you know that they can't get full range, and we're looking for that grimacing. And open up that way.
Okay. All right, now we'll do some lower extremity stuff. Erin's going to take the chair. I'm going to move this down a little so you can see better. Okay. So, two of the main things that are tight on most of our kiddos are their hamstrings and the heel cords. So those are the things I'm going to focus on here. We'll start with that. So to get a good hamstring stretch, first you want to make sure the student is sitting all the way back in the chair. So make sure the pelvis is all the way back. And that the lap belt is put on nice and tight if they're in a wheelchair to make sure that their pelvis isn't sliding forward. Because the hamstrings come along the back of the leg and then come up to here. So when I'm stretching the hamstring at the knee, it will make the pelvis tilt back. So just be aware of what the pelvis is doing while I'm stretching the hamstring or doing the range of motion for the hamstring. So what I'm going to do now is slowly pick the leg up. Her leg is pretty much supported by the chair. I can just kind of hold here to give it a little more support. Grab it here right above the ankle and slowly bring it up until I feel some resistance. Now, Erin's a little tight in the hamstrings. That's as far as she's going to go without her pelvis like tipping back. Now, let's go ahead and go all the way up and let's see what happens with your pelvis. So if I'm going to try to stretch her out a little more, like her pelvis kind of tilts back a little bit. But we just want to go to as far as she can go without movement in that pelvis. So if that's here, then we hold it there for maybe about 10 seconds or so to give it a little stretch and then back down. If they can tolerate 20 seconds, do it a little longer. Okay, so that's the hamstrings. The next one would be the heel cords. A lot of times our kiddos, their feet are kind of pointed down a little bit, and then that causes some tightness here in the heel cord. So the first thing you want to do before you start bending the foot up to stretch that out, you want to make sure that they are in a neutral position, that the foot's not turned in too far or not turned out too far. So you first want to get them neutral so they're not in or out, okay? And then you want to support them right here and bring the foot up. If they're really tight, then often what I do, I'm going to take this off for a second, Erin. I'll even grab them at the heel, get a good grip of the heel and at the forefoot and pull like that. So I'm bringing this hand out and up as I'm pushing this hand back, okay? So pulling that heel as I'm stretching back. The reason why I do that is because if I'm just pushing here, then I'm almost just stretching the bottom of the foot. I want to make sure I'm getting that heel cord here. So that's why I'm grabbing the heel and pushing up. And just a reminder again, make sure you're in neutral position. It's not twisted in or out, that you are coming straight up and holding. Another stretch that doesn't work so well in the chair, sometimes we work a little bit on kind of pushing the legs apart to stretch out those hip adductors. That's another kind of easy stretch to do, but that's better to do when they're lying down on their back. Okay, thank you. I hope that works for you.